they put themselves in the front line of danger. In many cases, and particularly, sadly, those from ethnic minority backgrounds paid a terrible price.
They did. They paid a terrible price. So it's in this context that FEMHO seeks insights into various aspects and understands the challenges faced by ethnic minority healthcare workers and communities during this unprecedented time. Now, let me start. I've only got a handful of topics. Let me start with my first topic. Mr. Johnson, considering the expert testimony of the Chief Scientific Advisor, Sir Patrick Vallance, that disparate health outcomes based on vulnerabilities were, quote, entirely foreseeable, and the acknowledgement that pandemics exacerbate existing inequalities rather than creating them, I'd like to focus on the period leading up to the first lockdown in March 2020. During those critical days, why didn't your government put any measures in place in anticipation to mitigate the potential harsher effects of the pandemic on vulnerable and minority groups? Can you help me with that, please?
I certainly can. I think that we recognise that a pandemic, as Sir Patrick has said, was going to be brutal for the whole country. But I think that one of the things that I'd been told from the beginning was that if you remember the conversations that we'd had about the downsides of lockdown, is that they were likely to be felt particularly by those from lower income groups, ethnic minority backgrounds, who would typically, it's a generalisation, be more vulnerable.
Yes.
So at that particular stage, it was one of the reasons why we were so careful about the timeliness of the lockdowns that we've described.
Mr. Johnson, just help me with this, because I may have missed this. Bearing in mind that these, as you've just said, were anticipated in low-income groups, ethnic minorities, tell me, what were the measures that your government put in place to protect these groups?
So I described the disparate impacts of MPIs and lockdowns and the way that affected policy. What we didn't at that stage know, and I think that's what Patrick is talking about, but what we didn't at that stage know is the extent to which the virus itself would impact different groups differently.
Wow.
And that was only ready to become apparent in the course of the weeks ahead.
Well, you say in the weeks ahead, very early on it became apparent. The first 10 doctors who died were from ethnic minority backgrounds. The first 10 doctors were doctors of colour, Mr. Johnson. You knew that, right?
And that is correct. And
so can I just clarify? You knew that?
Well, let me say what I knew. I knew that from the, and I think I'm right in saying that of the victims in the NHS staff, I think I may have got the figure wrong, but I think it's something like 60% in the first year were from ethnic minority backgrounds. I may be wrong about that, but it's something of that order. It was falling disproportionately on BAME staff, and we did spot that very early on. I was very worried about it, and I tried to find out why as fast as we could.
Yeah, Mr. Johnson, just so we're clear, I'm not for one moment suggesting that you didn't try to find out why. What my question was aimed at is what you did, what measures, protective measures, did you put in place to protect these vulnerable groups? That was my question. But let me move on, because time is short. Let me move on to...
Well, so we put in all sorts... It would be fair to say, until we'd established the chain of causation and what was going on, it was difficult to put in specific measures for specific groups. But clearly we needed to do more to protect NHS frontline staff, and they made a huge and tragic sacrifice.
Yeah, well, we can agree on that. Let's move on to my second topic. In your witness statement, you acknowledge that there was a vast estimation of the risks related to disparities in health outcomes, and you state at paragraph 46. You state this at paragraph 46. Now, considering this acknowledgement, what were the specific factors or considerations that contributed to this underestimation in the context of disparities in health outcomes, particularly those based on ethnicity?
I think that to begin with, we were looking at the data as it started to come in. It was heartbreaking, and we were uncertain as to the cause. And the question, bluntly, was whether there was whether there were medical reasons, or whether there were, as it were, occupational reasons for the greater suffering. And I think it took us a while to try to get to the answer. I mean, we tried to get the answer quite quickly, but a great deal of work was done on that subject. The answer, as I'm sure you of course know, is that it appears that there isn't any medical grounds. What it I'm afraid tragically was fantastic NHS staff from ethnic minority backgrounds in the front line dealing with patients and being exposed to the virus.
Well, it was more... Sorry, forgive me, Mr.
That's what it seems to me to be.
Well, forgive me, Mr. Johnson, it's more than that. We had your former Health Secretary, Mr. Hancock, sitting where you were sitting, I believe last Friday, and he agreed with me, and I'm sure you will agree with me, that we can also agree that part of the disproportionate impact on the Black, Asian and minority ethnic communities, including healthcare workers, was as a result of institutional racism within the NHS and within the system. Can we agree on that?
I'm not certain. I'm afraid to say that I've seen evidence to support that.
Well,
I'd be.
You are unaware of the report done by Public Health England into the NHS that Mr. Hancock was telling us about, where it was talking about institutional racism. You're completely unaware of that as Prime Minister?
I haven't. I've got to confess to you, seen that report. The information that I had was that wasn't the information that I had did not mention that as a factor.
All right, let me move on. Mr. Johnson, the June 2020 Public Health England report has been cited as a pivotal moment in the understanding and addressing the disparities in risks and outcomes relating to the COVID pandemic. Would you consider this report to be your first substantive opportunity for engagement on this crucial issue?
Oh, so on which issue?
I'll repeat the question. On the issue of addressing disparities and risks and outcomes related to the COVID-19 virus.
Right. Well, what we did was to try to make sure that everybody had the best possible protection, and to do whatever we could to stop infection of those particularly Black, Asian, minority ethnic groups who were in the front line of the fight against COVID. And,
right. So, Mr. Johnson,
and sometimes, tragically, we didn't have PPE that was good enough, but we made a huge effort to equip our country with what was necessary.
Sometimes you didn't have PPE. There was an issue at times, was there not, in relation to PPE not being culturally appropriate, you know, people with beards, religious outfits, things like that. Were you aware of that?
That wasn't escalated to me. I was concerned that everybody should have the best possible protection.
Let me move on. Can you share with us your reflections on how the findings of this report influence subsequent actions and policies aimed at mitigating these disparities?
I think that what we wanted to do was to make sure that the incredible frontline staff of the NHS had greater protection, above all by being less overworked. And one of the things that the pandemic was a terrible time, but one of the things that we did was not only to embark on a big program of hospital building, but recruiting 50,000 more nurses. And I think we're well on the way to, well, the subsequent government's well on the way to achieving that now. And if you're a nurse or a frontline worker, then clearly one of the best ways to mitigate the risk that you face and the disproportionate risk that you face as a black, Asian, minority ethnic frontline care worker is having an extra pair of hands to help you. And that was one of the key objectives of the program. It's a very large program. There are plenty of other things that the NHS now has, I believe, or certainly did, but I was Prime Minister, more people in it than it's ever had.
Mr. Johnson, forgive me. Thank you.
They have limited time, Mr. Johnson.
So I'm not trying to talk
I'm
you
sure you're not trying to talk me down the block.
I wouldn't dream of that.
You wouldn't dream of that, would you, Mr. Johnson?
I wouldn't.
No. Right, I have two more topics and I've finished. Given the first indications of starkly disproportionate rates of infection and mortality in ethnic minority communities, which began to emerge in late March, early April, can we agree on this? Can we agree that there were earlier opportunities for more substantial engagement? Can we agree on that?
I don't know what you mean by that.
Well, let me be blunt. Your government could have done a lot more, a lot earlier.
Well, we did whatever we could to get all our staff the equipment that we.
It wasn't enough, Mr. Johnson, was it?
Well, we worked incredibly hard and fast to get people the equipment we needed. That doesn't mean that I'm not conscious of the immense effort and
we were clapping for. Do you remember?
I do, and I am deeply conscious of the sacrifice that they made.
Last topic, and then I'll sit down and I'll shut up. At paragraph 656 of your witness statement, you say, quote, "I was not provided with and did not consider any equality impact assessments when making decisions about imposing, easing, or making exceptions to NPIs. But that's not to say I did not receive and consider many documents containing details of the effects of lockdown across society or equalities and distributional impacts," end of quote. Question. In the absence of such assessments, and that's the equality impact assessments, can you shed light on the sources of intelligence or information that informed your understanding of the disproportionate impact of NPIs on ethnic minority groups? What were the sources of your intelligence and information?
Well, there was data that I saw. I can't tell you exactly the provenance, but there was data that suggested that I think when you come to lockdowns, people from the Bangladeshi community were 4 times more likely to be engaged in closed sectors. People from the Pakistani community were, I think, twice as likely to be engaged in closed sectors. From my own extensive work as chairman of Transport for London and all the work I did as mayor had taught me the massive disproportionate impact measures such as closures of retail, hospitality, and so on were likely to have on those very groups. So I didn't need.
You didn't need the intelligence.
I knew.
You knew.
I was getting data, but I also knew that these measures were likely to be disproportionate in their.
Thank you, Mr. John. I concede another 30 seconds under my time. Thank you.
Thank you, Mr. Thomas.